For a long time, Jim was on all the right medications for the physical symptoms of Parkinson's, but for the troublesome hallucinations and delusions, the doctors did not offer any solution, despite it being a treatable condition. So when I asked about it, he didn't seem overly alarmed. He said, yes, this is part of what happens, and he may have adjusted his medicine. The increase of his well-being in his physical state, his body, is in direct proportion is the psychological downside. So it's almost the better his body was, the worse his psychological state was. It made him feel good. He could walk better, but his psychological state was 100% a nightmare. Do they know that it's dopamine that causes that? Or would it happen on its own without medication?
I've only played a doctor on TV.
We now know that Parkinson's-related hallucinations and delusions can be a part of the natural progression of the disease and not caused by or due to dopamine replacement therapy. That said, dopaminergic therapy can exacerbate a patient's Parkinson's-related hallucinations and delusions. The good news is that nowadays, clinicians don't have to choose which symptoms to treat, the motor or the hallucinations and delusions. Our goal is to help manage Parkinson's-related hallucinations and delusions without impacting the motor symptoms or function.
I would have loved to have had the option to help my dad see reality a little bit more clearly and ease his pain and suffering associated with and around his experiences with delusions and hallucinations. I can imagine that he felt incredibly alone and deeply afraid. In retrospect, I would give just about anything to be able to go back and make some of that a little less of a burden for him.
Yes.
A ton of stuff has happened that I wish my dad could have seen, but I also think that one of the best ways to honor him is to improve the lives of people with Parkinson's disease and the families that love and care for them. It's why I'm proud to be working with Acadia and get this story and this message out. There are viable options that are available for patients of Parkinson's disease, and thankfully, Parkinson's-related hallucinations and delusions is a treatable condition. My experience, I think, is a common cautionary tale. The good news is that now we know more, and we can do more about Parkinson's-related hallucinations and delusions, and, if we know more, we can do more.
Take control before hallucinations and delusions get out of control.